We often hear about, the amazing tech and treatments and healthcare, but have you ever really stopped to think about what's underneath all that?
Hmm.
Like the fundamental principles that guide a healthcare organization towards giving the best, safest care.
Yeah, it's like understanding their core identity, right?
Yeah.
The basic why and how behind everything they do.
Exactly. It's like having the decoder ring, as you said. So, okay, let's unpack this a bit.
Definitely. And knowing this stuff, it's useful whether you're uh, a patient working in healthcare or honestly just curious about how these places tick. It shows you what really drives their decisions.
Couldn't agree more. So for this deep dive, we're really zeroing in on three key things: the vision, the mission, and the quality policy of healthcare organizations.
Right.
And we've pulled insights from some major players. We're talking Joint Commission International, JCI. You probably know them.
The global standard.
Yeah, and the National Accreditation Board for Hospitals and Healthcare Providers, NABH over in India. Also, Supreme Medic Consultancy, ISQA, that's the International Society for Quality in Healthcare.
Quite a lineup.
Then we'll mix in some, basic definitions too, just to keep everything clear.
And the goal here isn't just to define these terms like in a textbook. We want to get into their real impact.
Yeah, why do they actually matter?
Exactly. Why are they so critical for quality and, maybe most importantly, for keeping patients safe?
Okay, let's kick things off then, the vision statement. When a hospital or clinic talks about its vision, what? What are they actually picturing?
Think of the vision statement as like the mountain peak a climber is aiming for. It's that long-term, really aspirational goal.
The ultimate destination.
Precisely. The big dream. It's what the organization wants to become or the future state they want to help create in healthcare.
So less about today, more about tomorrow. Or, well, the day after tomorrow, maybe.
Kind of, yeah. It's their ultimate ambition. Can I give some examples?
Please do. Make it concrete for us.
Okay, so you might see something like to be the leading center for specialized cardiac care, known for exceptional patient outcomes.
Right. Very specific.
Or maybe to create a healthier community through compassionate, innovative, and accessible healthcare.
Community-focused.
Or even to pioneer medical breakthroughs that transform patient lives globally. Big stuff.
Okay, I definitely get the aspirational vibe, but how does that big dream actually, help improve the care I might get today?
Okay, this is where it gets really interesting. Think of the vision like an architect's blueprint for a huge project.
Okay.
It's not about the individual bricks being laid right now, but that blueprint. It dictates the whole design. It makes sure every single thing added later fits that original ambitious goal, say, creating a world-class hospital.
So it guides everything, even years down the line.
Exactly. A clear vision inspires everyone, doctors, nurses, admin, to keep pushing, keep getting better. It's the guiding star for strategic decisions, for quality improvement plans. It builds that long-term commitment to patient results.
So it's not just fluffy words on a website. It actually fuels improvement.
Precisely. And for you, listening, when a provider has a clear, compelling vision, it suggests they're committed to growth, to evolution.
Right. Not just standing still.
Yeah, they're actively working towards a better future for their patients, for the community.
No, okay, that makes sense. Let's shift then. What about the mission statement? How's that different from the future-gazing vision?
So if the vision is the someday, the mission is very much the what we do every single day to get there.
The practical side.
Exactly. It's the organization's current identity. It explains why they exist right now, who they serve their specific patients, their community, and the value they're trying to deliver in their day-to-day work.
So it's the what we do and who we're here for right now.
Perfectly put. It's a snapshot of their core activities and their reason for being today.
Can we look at an example of a mission statement?
Sure. A pretty common structure might be something like to deliver exceptional patient-centered healthcare with compassion and respect through continuous innovation and a commitment to excellence in service. See, it defines the what healthcare delivery, the how, compassion, innovation, excellence, and it implies the for whom, the patients.
Right, much more immediate. Now, how does that drive quality improvement?
Well, what's fascinating here is that the mission acts like a compass for all the quality stuff.
Okay.
By clearly stating the purpose and values, it makes sure everyone from the top brass to the front line is pulling in the same direction.
Alignment.
Exactly. So if the mission shouts patient-centered care, then your quality projects are naturally going to focus on, improving the patient experience, better communication, tailoring treatments.
Makes sense.
It keeps everyone focused on delivering real value, meeting patient needs, which is basically the heart of quality improvement.
So if a hospital's mission talks about continuous innovation, we should probably see their QI efforts reflect that, like trying new tech or methods.
Precisely. And for you, the listener, a clear mission gives real insight into their daily priorities. It tells you what kind of experience they're actively trying to create.
It helps set expectations.
Yeah, it helps you understand the principles guiding their everyday actions.
All right, vision, mission. Let's complete the trio with the quality policy. What's that about?
Okay, the quality policy. This is the organization's formal, often public, commitment to quality. It's about maintaining and constantly improving standards in everything they do.
So it connects the vision and mission to reality.
You could say that. It's the bridge. It's their firm pledge to meet expectations, follow the rules, yes, but also to always look for ways to get better. It's like their documented promise of quality.
The concrete commitment to actually doing quality work day in, day out.
Exactly. It's where they plant their flag and say, we are serious about quality, and here's our approach.
And based on the sources we looked at, places like Yetharth Hospitals or the Delhi Council for Child Welfare, what kind of commitments do these policies usually include?
Well, drawing from those and, general QI principles, you almost always see a really strong, explicit commitment to patient safety and well-being. That's paramount.
Naturally.
And there's usually a big emphasis on continuous improvement, not just fixing problems, but proactively getting better and using evidence-based best practices.
Using what works.
Right. And a focus on actively understanding and meeting patient needs is key. You'll also find commitments to the highest clinical and ethical standards. And increasingly, policies mention using data to make decisions.
Data-driven quality.
Yes, and empowering staff, giving everyone a role in improving quality.
Those all sound like things that would definitely boost confidence. So why is having this formal policy so crucial for actual QI work?
Because the quality policy acts as the foundation, the bedrock for all those QI efforts.
Okay.
It ensures that improvement projects aren't random, but actually line up with the bigger goals, the mission and vision. It helps create a culture of quality by setting clear expectations for everyone.
Standardization.
Yeah, promotes consistency across departments. And importantly, it sets benchmarks, measurable targets, so the organization can track its performance and be held accountable.
So it's way more than just a piece of paper. It's like a blueprint for embedding quality and safety everywhere.
Absolutely. And for you listening, knowing an organization has a clear, actively used quality policy, that offers real reassurance. It strongly suggests they're dedicated to excellent care, to your safety. It shows they're proactive about quality, not just reactive.
Okay, so we have the vision, the mission, the quality policy. We've defined them. How do these three actually work together? How do they interact in a real hospital or clinic?
Well, think of it like a finely tuned engine. The vision. That's the overall direction, the destination programmed into the GPS.
The long-term goal.
Right, the mission. That's the engine's day-to-day job, how it runs, how it generates power to move forward.
What we do.
And the quality policy. That's like the premium fuel and the regular, rigorous maintenance schedule. It ensures the engine performs consistently, prevents breakdowns, and optimizes efficiency on that journey towards the vision.
Okay, I like that analogy. So vision is where we want to be. Mission is what we do daily to get there, and quality policy is how we make sure we're doing it well and improving.
That's an incredibly clear way to put it, yes. Together, they form this really cohesive strategy for driving quality improvement. They lay the groundwork for planning quality, controlling quality, and constantly enhancing performance.
And this whole foundational structure, this is something accreditation bodies really look at, isn't it?
Oh, absolutely. Accreditation bodies are crucial here. They don't just check if these statements exist. They verify that they're meaningful, that they're actually used, and that they genuinely drive improvements in care quality and patient safety.
They provide that external validation.
Exactly. They check if the engine is actually running well, not just looking good on paper.
Let's dive into some of those key players then. We mentioned Joint Commission International, JCI. What makes them so important?
JCI is pretty much globally seen as the gold standard for healthcare quality and safety. Their mission is simple but powerful: to enable and affirm the highest standards of healthcare quality and patient safety for all.
High bar.
Very. And they do this by creating these incredibly detailed, rigorous international standards. Then they accredit organizations around the world that prove they meet and keep meeting these high benchmarks.
So getting JCI accredited is a big deal.
It really is. For you, seeing the JCI seal is kind of like seeing a top safety rating on a car. It signals adherence to a globally recognized level of excellence.
And what are the benefits for the organization itself, beyond the badge?
Well, according to healthcare leaders who've been through it, the process itself builds stronger teamwork, improves communication between departments.
Which is always good in healthcare.
Always. It can give them a competitive advantage, builds community trust, strengthens how they manage risks, and really embeds that culture of safety and continuous improvement.
And they operate worldwide.
Absolutely. JCI accredits programs in over 70 countries, Asia, Europe, the Middle East, Africa, the Americas. We're talking over 1,000 accredited programs. Their reach is huge.
Wow. Okay, now, what about NABH, the National Accreditation Board for Hospitals and Healthcare Providers? What's their role?
So NABH is part of the Quality Council of India. It was specifically set up to run accreditation programs within India.
Ah, a national focus.
Exactly. Their main goal is to set benchmarks for the Indian health industry, making sure providers meet consumer needs through strong quality and safety standards tailored for the Indian context.
So while JCI is international, NABH provides that focus standard within India.
Precisely. And it's interesting, you see organizations like Supremedic Consultancy popping up. Their whole job is to help Indian hospitals navigate the NABH accreditation process.
Shows the practical side of implementing these standards.
Exactly. It shows how these principles turn into real-world action.
Okay, last one on our list. ISQA, the International Society for Quality in Healthcare. How do they fit into this picture?
ISQA is a bit different. It's a global, member-based, nonprofit organization. They've been around for over 30 years, really championing quality improvement worldwide.
Championing how so?
Well, they do it through things like education, sharing knowledge and best practices, offering external evaluation services, and generally supporting health systems globally in their quality journeys. They have this huge network of professionals in, again, over 70 countries.
So ISQA is more about fostering the global movement for quality and safety, providing resources and connections.
Exactly. Think of them as nurturing the ecosystem. And if we bring it back to our core topic, vision, mission, quality policy, ISQA strongly promotes these as the essential building blocks.
Starting point.
Yes, the fundamental pillars for any organization serious about quality improvement, which is what ISQA supports globally.
Okay, so let's try and pull this all together. The vision inspires the long-term goal. The mission defines the current purpose and actions. The quality policy locks in the commitment to standards and improvement.
Mm-hmm.
And then you have vital groups like JCI and NABH providing specific frameworks and validation.
Right, the accreditation piece.
While ISQA works to boost the whole global effort towards better, safer healthcare.
Precisely. These aren't separate ideas. They're deeply interconnected. They work together like gears. It's all part of a comprehensive approach to ensure organizations aren't just providing care, but are constantly striving to provide the highest quality, safest care possible.
And for you, listening, understanding these foundational bits, the vision mission policy gives you a really valuable insight.
Yeah, into their core values.
Right, into the priorities of any healthcare place you deal with. When you see a clear vision, a mission focused on patients, a strong quality policy, especially if it's backed up by accreditation.
Mm-hmm. It's that external stamp.
It tells you a lot about their dedication to your well-being, their commitment to doing things right. It's definitely something worth thinking about when you're making choices about care.
Which actually raises a really interesting question for you to consider. How does knowing about an organization's vision, mission, and quality policy actually change how you feel about their commitment to you?
Yeah, does it affect your trust?
Right. And how might these statements, these core principles, influence your decisions next time you need healthcare?
That's a powerful thought to end on. It really drives home that these aren't just corporate buzzwords. They're potentially the bedrock of quality and safety in this incredibly complex, always changing world of healthcare.
Mm-hmm.
That clear sense of purpose, that genuine commitment to quality, that's ultimately what builds trust and leads to better outcomes for all of us.